Hi, let us read about digoxin use and toxicity in heart failure. Digoxin, a cardiac glycoside derived from digitalis, is used for patients with systolic heart failure, atrial fibrillation, and atrial flutter. Digoxin improves cardiac function as follows. First one, increases the force of myocardial contraction. Second, slows cardiac conduction through the AV node and therefore slows the ventricular rate in instances of supraventricular dysarrhythmias. Third, increases cardiac output by enhancing the force of ventricular contraction. Fourth, promotes diuresis by increasing cardiac output. The therapeutic level is usually 0.5 to 2.0 nanogram per ml. Blood samples are usually obtained and analyzed to determine digitalis concentration at least 6 to 10 hours after the last dose. Toxicity may occur despite normal serum levels and recommended dosage vary considerably. Preparations. Digoxin preparations as tablets 0.125 and 0.25 or 0.5 milligram lanoxin. Capsules 0.05, 0.1 and 0.2 milligram. That is lanoxy caps. Elixir 0.05 milligram per ml. Lanoxin pediatric elixir. And injection 0.25 milligram per ml and 0.1 mg per ml lanoxin. Digoxin toxicity. A serious complication of digoxin therapy is toxicity. The incidence is high and toxicity may occur even though the serum digoxin level remains within a normal range. Diagnosis of digoxin toxicity is based on the patient's clinical symptoms, which include the following. First one, fatigue, depression, malaise, anorexia, nausea and vomiting. Early effects of digitalis toxicity, these are the things. And the next one, changes in the heart rhythm, new onset of regular rhythm or new onset of irregular rhythm. Third one, ECG changes indicating SA or AV block, new onset of irregular rhythm indicating ventricular dysarrhythmias and atrial tachycardia with block, junctional tachycardia and ventricular tachycardia. Reversal of toxicity. Digoxin toxicity is treated by holding the medication while monitoring the patient's symptoms and serum digoxin level. If the toxicity is severe, digoxin immune may be prescribed. Digibind binds with digoxin and makes it unavailable for use. The digibind dosage is based on the digoxin level and the patient's weight. Serum digoxin values are not accurate for several days after administration of digibind because they do not differentiate between bound and unbound digoxin. Because digibind quickly decreases the amount of available digoxin, an increase in ventricular rate due to atrial fibrillation and worsening of symptoms of heart failure may ensue shortly after its administration. Nursing consideration and actions. 1. Assess the patient's clinical response to digoxin therapy by evaluating relief of symptoms such as dyspnea, orthopnea, crackles, hepatomegaly and peripheral edema. Second, monitor serum potassium levels in patients receiving digoxin, especially those receiving both digoxin and diuretics. An undetected, uncorrected potassium imbalance predisposes patients to digoxin toxicity and dysarrhythmias. Third, assess for symptoms of electrolyte depletion, lassitude, apathy, mental confusion, anorexia, decreasing urinary output, and azotemia. Fourth, monitor the patient for factors that increase the risk of toxicity. Oral antibiotics, quinidine, amiodarone, calcium channel blocker therapy, and decreased potassium level hypokalemia, which increases the action of digoxin and which may be caused by malnutrition, diarrhea, vomiting, or prolonged muscle wasting, and impaired renal function, particularly in patients age 65 and older with decreased renal clearance. Fifth, before administering digoxin, it is standard nursing practice to assess apical heart rate. When the patient's rhythm is atrial fibrillation and the heart rate is less than 60 or the rhythm becomes regular, the nurse may withhold the medication and notify the physician because these signs indicate the development of AV conduction block. Although withholding digoxin is a common practice, the medication does not need to be withheld for a heart rate less than 60 if the patient is in sinus rhythm, because digoxin does not affect sinoatrial node automaticity. Measuring the PR interval for a patient with cardiac monitoring is more important than the apical pulse in determining whether digoxin should be held. A special note, if monitoring discloses that the patient is in sinus rhythm, the nurse monitors the patient's PR interval instead of the patient's heart rate. If the patient is in atrial fibrillation, the nurse monitors for the development of regular RR intervals indicating AV block. Sixth, monitor for gastrointestinal side effects, anorexia, nausea, vomiting, abdominal pain, and distension. Seventh, monitor for neurologic side effects, headache, malaise, nightmares, forgetfulness, social withdrawal, depression, agitation, confusion, paranoia, hallucinations, decreased visual acuity, yellow or green halo around objects, especially lights, or snowy vision. 8th, observe for anticipate potential drug interactions when other medications are added to the patient's regime. This is an important step in preventing toxicity. For example, antiarrhythmic and antibiotic medications may increase the amount of digoxin available to the patient. Diuretics may decrease the amount of potassium and increase the availability of digoxin. In addition, because digoxin is eliminated by the kidneys, renal function are monitored carefully, especially serum creatinine and urine creatinine clearance. Thank you. Please share with your friends and ask them to listen. Thank you so much.